So cancer-associated thrombosis, or CAT, is a very common condition. It's when people develop a clot, usually in the deep veins of the legs or the arms, and that clot can cause what we call a deep vein thrombosis. That in itself is quite painful, can be very inconvenient, but the major thing that we worry about is that clot could then break off and go onto the lungs. That's something called a pulmonary embolus. That can cause a breadth of symptoms from breathlessness, chest pain, but in its most severe form can be fatal. Now, patients with cancer are at a much higher risk of getting CAT or getting any sort of clots because the actual cancer itself releases molecules that make the blood more sticky. So we've got evidence which shows that molecules like tissue factor is released, which increases the clotting cascade. So we know that cancer itself releases molecules that make the blood more sticky, but not all cancers are the same. For example, lung cancer, brain cancer, pancreatic cancer will increase the stickiness of the blood 20-fold, whilst breast cancer and prostate cancer may be 4-fold. However, if you have metastatic disease, that'll increase your risk further 20-fold, probably because we've got a more active cancer or we've got a greater disease burden releasing procoagulant molecules. Another thing that I think is very important to note is that chemotherapy and other cancer treatments increase the risk of thrombosis. So if I were to illustrate perhaps early stage breast cancer, the risk of thrombosis is 2 per 1,000. But if you give adjuvant chemotherapy, that risk goes up to 2%, so a 10-fold increase. If you have someone with stage 4 breast cancer who's receiving palliative chemotherapy, the rate is 8%. So it's not inconsequential. The other thing that's very important to note is that actually the commonest cause of death during chemotherapy is actually thrombosis. Now, when we give our patients chemotherapy, they're made very aware of the risks of sepsis. And just about every patient I see would be able to tell me that if they get a temperature, a rigor, feel generally unwell, they'll ring a phone and there'll be a helpline in which they can get treated immediately for sepsis because time is of the essence. Yet the average time it takes a patient with red flag symptoms of a clot to present is 9 days, and yet this is killing as many people, if not more, who are getting sepsis. We've done a lot of qualitative research with patients who've had cancer-associated thrombosis, and some of them would actually describe the experience as more distressing than being told they have cancer. And I think there's a couple of reasons for that. First of all, most people working in the field of oncology have been trained how to communicate and break bad news. So when the patient is told they have cancer, it tends to be done in a quiet area where they're not going to be interrupted. There's some support staff there with availability and information and an opportunity to regroup. Patients' experiences of CAT tends to be a far more rushed, haphazard event. So either they present very poorly and everything is very rushed, or those who have incidental thrombosis, which means one that's picked up on a staging scan or a scan to reevaluate disease status after treatment, they tend to get phoned about the result and told, can you come in now? We found a clot on your lung. And they feel well, they don't want to come in because they're busy, and someone they've never heard says, you must come in now. No, I'm busy. Well, if you don't, you could die. So this is a person who's already faced their mortality with a diagnosis of cancer, is now getting told over the phone that they have another threat to life. Yet they weren't given that information with the same support and trained staff as they did when they were told they had cancer. Another thing that's interesting is that over 50% of people who get CAT will do so in the first 3 months of their cancer diagnosis. Now this is most likely because that's when they've started their treatment, so the clots will appear after. You imagine the psychology of someone who's just getting their head around the fact they've got cancer to within a few months or even earlier being told they have another threat to life. That causes a lot of distress. Plus, if they're not given adequate information about it, they do what we all do. We go to that anarchic library known as the internet, where they will find all sorts of unregulated information, or even the accurate information which says this is life-threatening, will be there and frighten them without them having the opportunity to have a healthcare professional put it in context and support them.